Welcome to the Public Health Center of Cipayung Subdistrict. During the COVID-19 pandemic, the Public Health Center of Cipayung Subdistrict still provides health service for children with the following procedures. First, visitors must wear a mask. Second, before entering the room, the visitors must pass through disinfectant chamber. Third, the visitors must wash their hands in 6 steps by using soap for 20 seconds with flowing water. Fourth, the visitors must maintain a 1 to 2 meter distance with the other patients. Fifth, security guards will check the visitor's temperature before approaching the registration table. Sixth, the visitors take queue number and register according to health service needed and keep maintaining a distance with the other patients. Our public health center provides 2 categories of service for children. First, service for healthy children under 5 of age, comprising immunization service and Sikembang service to examine detection, stimulation, and early intervention. Second, service for ill children under 5 of age, comprising integrated management of childhood illness. In the service, patients are divided into 2 categories, namely URI patient and non-URI patient. The first will be directed to Children Polyclinic for cough treatment, while the latter will be proceeded to non-MCI room. To mothers who come for children immunization service, don't forget to perform precautionary measures by wearing a mask and using hand sanitizer. And also, don't forget to bring your pink book. See you and stay healthy.
Pak, chúng ta áp dụng 12 giờ hàng.
Buka, Bu. Halo, Pak Beta.
The first 5 years are children's golden age of growth and development, when they begin to recognize their 5 senses and absorb so many things around them. At this age, parents play very important roles, especially in parenting, providing their children nutrition, and taking care of their children's health. Doctors, nurses, midwives, and health personnel play roles as a family's partner who are always ready to get involved directly in community, even to become reliable key supporters in education units. Conducting direct examination to the children, giving advice to their parents on health issues, providing guidance on hygiene behavior, health, and daily nutrition. Health personnel always stand by at integrated health service station in every city and village to immediately serve the community, whether for checking the ideal infant weight or for examining the infants and under 5 children's level of development. Also to ensure the parents get MCH handbooks as their trusted guidance.
Balita Sehat Indonesia Unggul.
Public Health Center as the facilities for providing health service to the community are always ready to monitor children growth and healthy and to ensure they achieve their maximum growth and development, to give MCH handbooks and to keep the children medical records and cohorts in every detail. Mothers use the MCH handbooks twice higher, antenatal care access, childbirth at health facilities, and childbirth service. Mothers use the MCH handbooks 4 times higher, complete basic immunization access, a time weighing access twice a year to conduct detailed and thorough examination on the under 5 children growth and development, to educate the parents in order to get involved supervising their children growth and development. Stimulation, detection, and early intervention on the children growth and development is performed with full of dedication. The health personnel use development pre-screening questionnaire to monitor the children growth and development, and the parents keep the record of their children's development period in the MCH handbooks. The health personnel must also be capable of becoming discussion media in order to make the parents feel comfortable and free to give information or ask questions regarding their children's development and health, and spend their time to attend class for mothers of children under 5 years of age as a means of educating parents as children nurturers. The greater the percentage of public health centers organizing class for mothers of children under 5 years of age, the larger the coverage of a time a year weighing for children under 5 years of age. And in deteriorating health condition, the health personnel are always responsive to handle the problem. The greater percentage of the public health centers performing integrated management of childhood illness, the lower the death rate of neonates, infants, and children under 5 years of age, because it is in their hands the future of our nation lies. If the children under 5 years of age are healthy, the generation will excel and Indonesia will prosper. Presented by Directorate General of Public Health, Directorate of Family Health. Welcome to the Public Health Center of Cipayung Subdistrict. During the COVID-19 pandemic, the Public Health Center of Cipayung Subdistrict still provides health service for children with the following procedures. First, visitors must wear a mask. Second, before entering the room, the visitors must pass through disinfectant chamber. Third, the visitors must wash their hands in 6 steps by using soap for 20 seconds with flowing water. Fourth, the visitors must maintain a 1 to 2 meter distance with the other patients. Fifth, security guards will check the visitor's temperature before approaching the registration table. Sixth, the visitors take queue number and register according to health service needed and keep maintaining a distance with the other patients. Our public health center provides 2 categories of service for children. First, service for healthy children under 5 of age, comprising immunization service and Sikumbang service to examine detection, stimulation, and early intervention. Second, service for ill children under 5 of age, comprising integrated management of childhood illness. In the service, patients are divided into 2 categories, namely URI patient and non-URI patient. The first will be directed to Children Polyclinic for cough treatment, while the latter will be proceeded to non-MCI room. To mothers who come for children immunization service, don't forget to perform precautionary measures by wearing a mask and using hand sanitizer. And also, don't forget to bring your pink book. See you and stay healthy.
Distinguished speakers, participants, ladies and gentlemen, hello, good afternoon from Jakarta, Indonesia. We are here wishing all of you in a healthy and well condition during this COVID-19 pandemic. Welcome back to the last day of knowledge sharing program on maternal and child health Handbook 2020 with topic sharing the experiences and lessons learned on MCH Handbook implementation in the era of COVID-19. With me, Gaung Antardayu. This program presented to you as a result of great collaboration between the government of Indonesia and Japan International Cooperation Agency or JICA. So, as my mandatory job, same as yesterday, I would like to inform you the housekeeping of this program. First, please turn off your Zoom microphone during the speakers do their presentation. Second, make sure you pay attention to the chat box, as some updates from the committee will be available on the chat box. Third, if you're facing some technical difficulties on your Zoom apps, please feel free to chat us, because our team here will respond and try to fix it for you. And the last, this program is also streamed online through YouTube channel. The channel also will available to you in the chat box. Distinguished speakers, participants, ladies and gentlemen, let us proceed to the first session for today's program. We will have day one review with Ms. Dwi Okta Amalia from the Ministry of Health. To Ms. Okta, the time is yours.
Distinguished delegates, ladies and gentlemen, thank you keep joining us this program since yesterday. All, I would like to give a review of Day 1 KSP MCH Handbook. The event went smoothly yesterday, even with challenges such as internet connection and audio issues from some participants. The Day 1 was participated by more than 120 people on Zoom webinar and more than 400 people on YouTube Live. Participants from 10 countries, totally 41 people. Observer from various sectors and development partner. Another Indonesia observer come from cross-program in Ministry of Health, 34 provinces health office, NGOs, and professional health organizations. Opening remark has presented by cross-sector government of Indonesia, Ministry of Health, Ministry of State Secretariat, Ministry of Foreign Affairs, and JICA Indonesia. Some countries have shared experience of MCH Handbook implementation in the era COVID-19 pandemic. They are from Indonesia, Laos PDR, Kenya, Afghanistan, and Tajikistan. The pandemic gives various impact to MCH services and status. However, all countries have ensured the continuation of MCH services by strengthening community empowerment through utilization of MCH Handbook. That's all for yesterday's review. I hope this event can improve your knowledge and inspire in the strengthening of the implementation of MCH Handbook in the COVID-19 pandemic era. Enjoy the workshop and thank you.
So, thank you, Ms. Okta, for the review from yesterday's agenda. So now, as a jump start for today's agenda, I would like to invite you to switch on your video from your Zoom apps, because we will have a mandatory selfie first. Okay, please switch on from Myanmar. Okay, so on my mark, we will have a virtual selfie. Okay. Is everyone on? Right? 1, 2, 3. You can give your best smile here. Okay, another one. 1, 2, 3. Okay, once more. Can we? Okay. Okay, that's it for the virtual selfie. Now, moving to the first agenda, we will have a presentation from Thailand, Timor-Leste, and Myanmar that will be moderated by Dr. Sri Wahyuni from our Ministry of Health. So to Dr. Sri Wahyuni, the time is yours.
Okay, thank you, Mr. Gao. Thank you for giving me the opportunity. So for this session, first of all, I would like to welcome all delegation, and I wish all of you in a health condition. For this session, we are going to have 3 presenters. One is from Thailand, second one is from Timor-Leste, and the last from Myanmar. I'm happy that here we have Dr. Titipon from Ministry of Public Health Thailand. He is MCH, he's from MCH Department of Health, Ministry of Public Health Thailand. And we are also happy to have Miss Madalena from the Ministry of Health of Timor-Leste. She is a Safe Motherhood Program Officer in the Ministry of Health of Timor-Leste. Also, we are very proud to have Ms. Tida Win from the Ministry of Health and Sport of Myanmar. She is a Deputy Director for Newborn Child Health Development. For this session, we are going to have 15 minutes from a presentation from each countries, from Thailand, Timor-Leste, and Myanmar. So I would like to give the floor first to Dr. Titipon. The floor is yours, Doctor.
Hi, good afternoon. Can you hear me?
Yes, we can hear you, but not really loud. Can you louder your voice? Thank you.
Okay, yeah.
That's great. Excellent. Have the floor.
Okay, so on behalf of Thailand and the Ministry of Public Health, and good greeting to everyone. I may start now because I have like a time limitation. Please continue to another slide. Next, please. Okay, next, please. Okay, so Thailand, we have the population of 69.8 million and the fertility rate is 1.5. Currently, the life expectancy is 76.9 years old. The total live birth, actually it is decreasing from years to years. And the latest result is around 600,000. In general, the health system is 99.9% of the Thai population is covered by the governmental insurance schemes. We consist of 3 schemes. The first one is the Universal Health Coverage Scheme, accounted for 75% of the total Thai population. The second one is the Social Security Scheme, which account for like about 30%. And the last one is the Civil Servant Medical Benefit Scheme. So overall, almost everyone in the Thai soil were covered by the government insurance schemes. Therefore, the out-of-pocket payment is about 11%. Next, please. For the maternal and child health status, the maternal mortality rate is 23.1. Actually, it's a little bit increased from last year, maybe due to COVID or other thing. The second one is the neonatal mortality rate is 4.2. Under 5 mortality rate is 8.4. And the mother-to-child transmission of HIV is 1.9. So it's below 2%. Next, please. For the implementation of the MCH handbook, we gradually developed the handbook since 1985, and then the latest one is 2019. So actually, we we tend to develop it due to the policies and also some of those next innovation that may come across in each year. So the financial support is funded by the National Health Security Office. It is we in each year we will calculate about 30% plus the latest year total live births. So like this year we distribute 800,000 copies nationwide to all of the government healthcare facilities and every private healthcare facilities that may request it. In addition, we also have another languages like English and Myanmar and Laos languages to distribute in some provinces that may need. Okay. Next, please. Okay. During the COVID-19 pandemic, we have a little bit of initiatives like we will see. And on your left-hand side is the infographic about what you should do when to protect your baby from the COVID-19 and then what you shouldn't do. Some kind of the infodemic that will distribute through the social media. Next, please. Okay. As we all know that Thailand is the first country outside China that report the COVID-19, and initially we have increasing rate and then we decided to lock down. So you can see from the graph that we have locked out and from March until early May, and then after that the situation is better and better. So right now we don't actually have the domestic cases. Therefore, the cumulative cases from January until present is around 3,800-ish, with 59 dead. And among all of those numbers, we got 3 pregnant women that was diagnosed with COVID-19 and 1 postpartum woman. So therefore, it's 4. Next. Okay. The health service that we have adapted due to the COVID-19 situation. The first one on your left-hand side is the flow of the antenatal care in the hospital. So we modified it into prioritize those emergency and urgent services. We use the appointment technology to decrease the overcrowded situation in the hospital, and also announce the new normal ANC service, the one-stop service that patient doesn't have to transfer from each point of care in the hospital. And the second one is that we use the technology assisted to screen for the high risk ANC the application, and also distribute this to the local healthcare workers. The third one is with some of the ANC visit we have postponed, but however we have locked down only March to May, so it's quite a short period. During that time we use the telephone or the line is application, the social media application to follow up the case. The fourth one is about we have the parental school. Previously it is the group education in the hospital, so we shift that group education from face-to-face into the line group. And the last one, we utilize the Early Moment Matters project. It is so-called Nai Yang, is in Thai anyway, but it's a self-directed, individualized messages to the pregnant women and mothers who have children under 5 years old. So these kind of messages will be personalized to the patients and the mothers and parents every day during the COVID-19 and beforehand. Next, please. For the community participants, in Thailand, we have the village health volunteer. Up to now, we have 1 million village health volunteer distributed nationwide. So they are the key factors of success to facilitate COVID-19 screening, maternal and childhood follow-up in every villages in Thailand. So we have utilized this kind of system that already in place during the pandemic. If they observe any of the abnormalities or any of the urgent situation, they will refer the mothers and child and other patients also in the sub-district health promoting unit or hospital. Next, please. For the current barrier and challenges, like many of the countries that have faced, that mothers and families, they are fears to come into the hospital because you also know that the COVID-19 patient maybe come to the hospital and they don't want their well baby to expose to that situation. So they tend to avoid by themselves, not to follow up like the immunization or some ANC appointment. And secondly, I'm not sure that whether any of us like have faced this or not. Like they are skeptical that is it possible for them to breastfeed their babies, because when you're breastfeeding, you have to be like very close contact to your child. So this one may got like an opportunity for the breast milk substitute companies to take into action, or like milk donation or that kind of thing. The third one is
allow me to remind you, you have 5 more minutes for the
yes,
presentation.
I've got 3 slides. Okay. The mothers and the absence of the parental school session because they cannot join in and they cannot practice like in person. So this may be like decrease in the skill of parental for the parents. And the fourth one is about the transportation, because during the lockdown period, the public transportation tends to reduce their timetable of like operations. And the last one is about the health system resource sharing, because during that 2 or 3 months, everything, even like personal, financial, and material resource will focus on the COVID-19 compared to other NCDs or even other communicable diseases service. Next, please. Okay, so about MCH handbook, of course, because the MCH handbook, we have like sufficient information to follow up the mother and the child health status. And then we consist of those nutrition in pregnant women and also children, physical activity, suggestion, child development, dental health, child injuries, maternal warning signs, breastfeeding, vaccination, and other common pediatric diseases. And the last one is about what I have told you, the UNICEF funded program like that we have like personalized messages every day. Next, please. Okay, and then apart from the social media in here, we also have the social media in Facebook that the medical professionals will come and like go live in Facebook about the hot issue or hot topic that they may have, that the population may have questions about how to deal with COVID-19 and their babies and their own health, something like that. And also, I need to emphasize on the village health volunteers again, because they are the one that closest to the population, and they are like the strongest system that we have right now. And the last one is about how we use the health service delivery system, like the service prioritization. We postpone those non-urgent services, and we have the appointment system, and we also have those kind of drug delivery. People that need the NCD drugs, they were able to receive it to the mail or to the Grab delivery, something like that. So they don't have to come into the hospital just to take their continuous drug. Okay, so that's it. I'm gonna conclude it. Thank you.
Okay, thank you, Dr. Titipon, for your comprehensive presentation. Now I would like to invite Ms. Madalena from the Ministry of Health Timor-Leste. Ms. Madalena, you have the floor.
Good afternoon from Timor-Leste.
Good afternoon, ma'am. Yes, you are very loud and clear. Thank you. Please continue.
Before I go to my presentation, I would like to introduce myself, Ms. Madalena, and I here my colleagues, Ms. Chuleta and Dr. Joseph Felix. They will be with me here for this presentation. Now, Timor-Leste is located at the eastern region of Asia with a projection population of almost 1.3 million. The total live birth per year is 33,548, and children under 5 years of 1,076,378 based on 2015 population census. In addition, we have 13 districts, 67 sub-districts, and 442 villages. The health facility center includes 1 national hospital, 5 referral hospitals, 71 community health centers, and 312 health posts. Moreover, we have a mobile clinic and 6 SISCA activities within the health posts. Next, please. As shown in this slide, based on 2016 demographic health survey, the maternal mortality rate are 195 per 100,000 live birth, with under 5 mortality rate of 41 per 1,000 live birth. This is derived from infant mortality rate of 30 per 1,000 live birth and child mortality rate of 12 per 1,000 live birth and neonatal mortality rate of 19 per 1,000 live birth. On the other hand, the CPR is 26%, antenatal coverage of 84%, postnatal check within 2 days after delivery is 35%. The children of age of 12 to 23 months is 49%. Similarly, for the facility birth and delivery by skilled providers of 57%. Next, please. This graph shows reduction about 60% from 2003 to 2010 and continued reduction of 65% within the next 6 years in 2016 as reported by Demographic Health Survey. Next, please. Additionally, for the childhood mortality as observed over 12 years from 2003 shows reduction of 23% from the first 7 years and 33% within the next 5 years for childhood mortality from birth to under 5. In addition, for birth to 1 year of 25% on the first 7 years from 2003 to 2010 and 33% within the next 5 years from 2010 to 2015 and birth to 4 years of 13% from the year 2003 to 2010 and 40% from the 2010 to 2015. Next, please. The percentage of children aged 12 to 23 months whom vaccinated at any time before the survey shows reaching 100% for BCG, one-third of DPT, hepatitis B and HIV, similarly for polio vaccination, and more than 50% for measles. Next, please. For the status of current implementation of the Maternal Child Health Handbook, or we call it LISIO, at the national system, it is being widely distributed and used across the country within all health facilities, with mandatory for all pregnant mothers receiving this handbook during their first visit antenatal consultation, and can be used until the child reaches 5 years. Next, please. The progress on international training program action plan since their participation in 2016 ITP held in Japan, we have introduction and implemented the new updated LISIO, or Maternal Child Health Handbook, which integrated the documentation of the ANC, immunization, growth monitoring, and PNC visits. In addition, from 2017 to now, we have included the health information on health education for diarrhea management and health promotion on healthy living and empathy on more comprehensive birth registration form. Next, please. In the COVID-19 pandemic period, Timor-Leste has reported its first confirmed case on 21st of March 2020, which classifies as imported cases. As of last week, we have 30 confirmed cases with no reported death and no maternal and child case. Next, please. The health service system to continue of care in maternal and child health services in responding to COVID-19 pandemic, Timor-Leste, with the privilege of continuous technical and financial support from all stakeholders, are able to strengthen COVID-19 related health system capacity as establishment of national community for COVID-19 under Minister of Health, Pillar 9, case management, including maternal child health service. Stabilize surveillance team and rapid responders training and standby. Stabilize and equipped at maternity ward at the designated central isolation hospital for COVID-19 case. Equipped national laboratory with testing capacity, stabilize government quarantine facilities, and ensure adequate stock of PPE for all health facility centers across the country. Next, please. In addition, with coordination for all DPHO across 13 municipalities, we conducted a municipality and national review meeting to report on progress within the first semester of 2019 and first semester of 2020, identify priority problems, and conduct discussion to develop action plan to be implemented within the next 6 months, and long-term action required as preparedness action to improve and maintain the safe and adequate health service of maternal, reproductive, neonatal, and child health during COVID-19 and beyond.
Ms. Madarena, allow me to remind you, you have 5 more minutes. for the presentation.
Next, please. The participation from the community in service implementation included healthcare volunteers in dissemination the COVID-19 related health information and a program initiated by GSI collaboration or USAID collaboration with Ministry of Health, TRACOM or community transport, which assist the transporting the pregnant mother and infant from home to health facility center and vice versa. Next, please. Challenge and encountered during the COVID-19 service implementation will divide into supply and demand side. From the supply side was still birth attendance was difficult to perform due to the lockdown requirement of restricting movement and physical and social distance practice. Moreover, fear of COVID infection and disrupted supply chains, including stock out of Lizio, lack of space, adequate equipment, and supply for isolation room for COVID-19 positive patients, poor water sanitation and hygiene in healthcare facility to maintain infection prevention control, and outbreak of other vector-borne disease such as dengue has limited of health professionals to perform safe and adequate maternal and child health service. Next, please. From the demand side, lack of information on service availability during the lockdown period, fear of being exposed to infection, food insecurity, lack of awareness on effective utilization of Lizio has higher care-seeking activity. Next, please. In overcoming the barriers through maternal and child health handbook, we answer yes, as with utilizing the Lizio or maternal child health handbook, we can identify children whom are fully vaccinated, needed vaccination during the lockdown period, in which through sweeping activities such as RCA conducted after the state of emergency is removed, the vaccination is administered directly on spots. In addition, mother undertaken routine ANC, PNC, and children's growth monitoring can be identified. Another strategy to overcome the stock out of implemented at some health facility is to ask the mother to bring or carry notebook to record their visit. Next, please. To enable sustainability in orientation and utilization of the Lizio or maternal child health handbook and maintaining the maternal and child service across the country, we request for sustainable provision of Lizio handbook and technical support for the orientation of the new Lizio for its effectiveness and utilization, such as continuous of ITP training for updated information. Thank you for your attention.
Okay, thank you, Ms. Madalena. Your presentation is very comprehensive. Now I would like to invite Ms. Tidawit from the Ministry of Health and Sport, Myanmar. Ms. Tida, you have 15 minutes. Please have the floor.
Okay. Can you hear me?
Yes, your voice is loud and clear. Thank
okay.
you.
Good morning, good afternoon, everybody. I would like to present the country report on behalf of Myanmar team. In our Myanmar team, there are four members two from the maternal and reproductive health division, and two from newborn and child health development division. We all prepared this PowerPoint presentation. There's in Myanmar, in our country, Myanmar, there is according to the census 2014, about 51.4 million population is here. Approximately half of population are male, and the rest, the remaining is a female. Children aged 4 to 14 years is a 44 million. That contribute 29% of total population. Youth age 15 to 24 years, also 18% of total population, and young people up to 24 years, that is also 28% of total population. In our country, it is composed of 7 regions and 7 states and 1 union territory. Most of the population are Buddhist, and we have 135 ethnic groups in our country. The healthcare provision we provided with through the 2 sector, public sector and private sectors. Public sector is mainly provided by our Ministry of Health and Sports and other related ministry, Ministry of Defense, Ministry of Labor, Population and Immigration. Private sector, we healthcare provision through the private sectors are through the private hospitals, general practitioners clinics and NGO clinics. Next, please. There is a maternal-mortality ratio in Myanmar. According to the UN interagency estimate, in 2000, there's maternal-mortality ratio was 340 per 100,000 live births. It is now declining, and in 2017, 250 per 100,000 live births. We have targeted for the estimated maternal-mortality ratio in 2030 is 216. The national SDG target is 99, so we are trying hard to get this target. Next, please. Transfer child mortality rates in 1990 to 2018 in Myanmar. We have declined, as you all see, we have declined the decreasing trend of the newborn mortality rate, infant mortality rate, and NFI mortality rate from 1990 to 2018. According to the UN interagency estimate of the child mortality report 2019 research. Next, please. According to our Myanmar population and housing census 2014 report, there is a child mortality rate of our states and regions in Myanmar. There is a union figure is there. NFI mortality rate was 72 per 1,000 live birth. Infant mortality rate was 62 per 1,000 live birth. Some regions and states are above the union figure, and some are below the union figure. That is the diversity among the states and regions. Next, please. That is the child mortality rate of states and region also, but that's included in the newborn mortality rate. According to the Myanmar Demographic Health Survey 2015-2016 report, that's the union figure is there. Newborn mortality rate NMR is 25 per 1,000 live birth, and our mortality rate is 50 per 1,000 live birth. Next, please. Our maternal and child health status in SDG. Our Ministry of Health and Sports all the activities being implemented to fulfill the following SDG, health-related SDG. Goal 3, ensure healthy lives and promote well-being for all at all ages. That's we have the health-related targets for target 3.1, target 3.2, target 3.7, the maternal and child-related targets. Next, please. There is a current implementation status of the MCH Handbook in National Health System. MCH Handbook was introduced in 2012. Before 2012, the home-based maternal record HPMR was used as a maternal record. MCH Handbook was introduced in 2012, and it was supplied mainly by government procurement. It is only in Myanmar language only. As I have presented in there are 135 ethnic groups in our country. There we have the diversity of the language, and so now we are trying to translate the ethnic group. This MCH Handbook was reviewed and revised in 2019, and now new version will be launched soon. Next, please. I would like to present the components of the MCH handbook in Myanmar. There's 9 components. That is, as you all know, detailed information of mother, information on importance of antenatal care, the do's and the don'ts, components of the quality ENK, danger sign, that is a different periods of the antenatal period, delivery, postnatal period, newborn period, and NFI children. And it also included the detailed history and findings on physical examination of current pregnancy and history of all previous pregnancies. It also included the bed plan, postnatal care records. All immunization, EPI schedule, and family planning methods information also included our MC handbook. And information on exclusive breastfeeding, weaning diet, balanced diet, weighted, also included in our MC handbook, and health record for newborn and up to 5 years. That is a components of our MC handbook. The figure of the MC handbook you can see in the right side of the slide. Next, please. This MC handbook is essential for the all pregnant women and NFI children. We use this MC handbook and immunization kit as a means of verification in 2 ways. First, I would like to describe. I would like to present MCCT, that is Maternal and Child Cash Transfer Program. This MCCT is a focus department, is a social welfare. MCCT is the provision of money for all for pregnant women and mother with child and 2 years. The amount of money is 15,000 Myanmar just per man for each pregnant woman and mother with child and 2 years of age. We have not covered the whole country. So, we have started and piloted in 2017 and 2018. Now we cover 6 states and regions and with Nagaland. So we can cover 33% of the country areas. And during the COVID-19 period, government have a social protection program that is what support to pregnant women. The focus department is also social welfare. There's a provision of money, 30,000 Myanmar just by each pregnant woman only through the Bike application. This means money transferring to the pregnant women during COVID-19 pandemic area. The implementing area is also the remaining of the MCCT program. That is, we have 2 states and 7 regions. We can cover 9 states and regions. So more than 50% of the coverage area. The pregnant women living in those areas can get this benefits. At the time, the MCH handbooks and immunization kit are essential as means of verification. Next, please. Our healthcare services are there, the continuum of care services and 3 delivery channels to cover the continuum of care across the health system. We have integrated of the intervention in our health system, pre-pregnancy, pregnancy, birth, neonatal, infancy, childhood, then adolescent. We have the continuum of care approach. Next, please. The progress of last year action plan. We have not get the last year action plan. We have not known very detailed, and so I have not discussed in this PowerPoint. Next, please.
Ms. Tida, allow me to remind you, you have 5 more minutes for the presentation. Thank you.
Yes, thank you. COVID-19 status of the Myanmar maternal and child related cases. Up to we have the source from the Central Epidemiological Unit for our Ministry of Health and Sports. Up to 26 October 2020, there is a pregnancy-related case, pregnancy, childbirth, postpartum, pediatric pregnancy-related COVID-19 positive cases 89. Among those, number of death was 2. That is one is a period, and the other one is a during pregnancy period. And 5 children of the number of COVID-19 positive cases, there's 19,074 cases. Among those, 2 deaths. There's one is underlying with the PEM, protein energy malnutrition, and another case is the Down syndrome, associated with Down syndromes. Next, please. There is we have compare during the COVID-19 period statement during the COVID-19 period 2020 compared with the last year the same period. At the time, percentage of women who receive anti-kill 4 times or more is slightly reduced. Yeah, we have the maternity and child care. They are reluctant to get the services or due to the homestay period or during COVID-19 period, health and care services are a little slightly reduced. Next, please. There's the similar, the coverage of postnatal care is also slightly reduced. We compare with the statement period of the during COVID-19 in 2020 with the same period with the 2019, that is slightly reduced. But proportion of the deliveries by patient health staff at hospital or delivery rooms are not significantly changed. Next, please. Our health service system for the continuum of care in maternal and child services, we have give, as you all seen, we have give the services of the antenatal care, institutional delivery, all services we give the community, primary health care, primary level and referral level, except institutional delivery. It is also in the primary and referral level. Home delivery is also community level. That is the health services in our country. Next, please. There are some major gaps along the continuum of care. From the source of the Myanmar Demographic Health Service 2015 to 2016, there are some gaps in the coverage of the visit vaccination, IYCF minimum acceptable diet, exclusive breastfeeding, postnatal care, institutional delivery, skills attendance rate, and neonatal tetanus protection, antenatal care for visit, and contraceptive prevalence. There are some major gaps along the continuum of care. Next, please. Country participants in the maternal and community participants in maternal and child services, we have awareness raising among the community about the danger signs of maternal, newborn, and children. Now we have reassurance the community to reduce myths and fears of disease transmission during the visit to the health facilities. Yes, please. We have the current barriers and challenges for the providing the continuum of care for during the COVID-19 pandemic situation. We have overburden of midwives. We have reduction of the service utilization by women and children due to fear and travel restrictions, and delay in transportation of commodities. Next, please. Our country had overcome the barriers and challenges by using the MCH Handbook. MOHs are all the related information in COVID-19 related information and other health related information. Our MOH website are up-to-date information, the daily up-to-date information. Website is ready. We are using internet platforms to educate mothers by using the information extracted from the our MCH Handbook. We have developed antenatal care Vanai sheet, birth plan Vanai, and postnatal Vanai. Also, danger signs for newborn and children Vanai from the information we have extracted from this MCH Handbook. Next, please. We need to address these challenges. We need a lot of financial as well as technical support to develop the online applications for mothers and caregivers for the children. Adaptation from the information on continuing of our newborn and children healthcare services during the COVID-19 pandemic. We have the monitoring system. We have monitored the efficiency and effectiveness of the maternal, newborn, and child healthcare delivery system by using our developed checklist. Next, please. Thank you so much for your kind attention.
Thank you, Ms. Tida, for the presentation. It's very interesting, excellent presentation. So now we come to the Q&A session. Based on my notes, we have some of the questions from the audience or the participants. One of them is, let me check with my okay. Question from Afghanistan, Dr. Sakar Haddad. This question goes to Thailand and Timor-Leste. The question is, what is your risk mitigation plan in case of COVID-19 continues? So I'd like to invite Dr. Titipon and Ms. Madalena to respond to the question from Afghanistan. Have the floor, Dr. Titipon first.
So the plan for risk mitigation of the COVID-19 continues. You need to know that the COVID-19 is continuing, and in some countries it's already like the phase 3 or another second wave or even third wave. So what is very important for the country is to prepare your healthcare resources to be prepared for another wave. For example, you need to have the stock of the PPE in place. You have to rehearse the COVID-19 plan, even in the policy level, and the policy, I mean the national policy across the government sectors and within the Ministry of Health working process. Like in Thailand, during the pandemic, we have every morning at 7:30 that we need to get in together all of the departments of the Ministry of Health, and we have the meeting to plan of the next process, whether we're gonna do the lockdown, how much PPE that we're gonna procure from other countries, or can we build our own factory to produce adequate of the PPE. This is very essential, and you need to plan the stock for every hospital to protect your healthcare workers, because without them you cannot ensure that the people will be safe. Okay, so the suggestion is that in Thailand we already plan, even like what if we have the second wave, what should we do, what is our plan, do we have ensure our stock of this thing, ensure the financial resources, something like that. I know if this sufficient for answers.
Okay, thank you. Thank you, Dr. Titipon. Now, Ms. Madalena, you have the floor to respond to the question, please.
Thank you, Afghanistan. To respond to your question about the risk mitigation of COVID-19 case, although we have not many, so the government stay vigilant in responding to this pandemic, and also continue applying measures as per WHO guideline, and continue to surveillance system, capacity building, MOC training, and also continue effort to develop to prevent community transmission. Thank you.
Okay, thank you, Ms. Madalena, for the explanation. I hope it will answer to the question, Dr. Sakan. So we go to the next question. It's coming from Indonesia, Muhammad Abdullah. Question for Timor-Leste. The question is, in case of insufficient room for isolation, is there any community empowerment to provide isolation room? For example, in village for infected people without symptoms. So I would like to invite Ms. Madalena again to respond to the question.
Thank you, Mr. Muhammad. So far, we have stabilized quarantine center at 13 municipalities. As for the preparation of travelers and isolation facility at the capital for any positive case, including a pregnant mother or children. Thank you.
All right. Thank you, Ms. Madalena, for the explanation. So we go to the third question, also coming from Indonesia, Dr. Retno. This question goes to Myanmar. Are there any obstacles in maternal child care during the pandemic? So I would like to invite Ms. Tida Win to respond to the question of Dr. Retno. Please have the floor.
Yes, of course, we have got a lot of obstacles of the maternal and child care services, because during the COVID-19 pandemic period, there are a lot of our health resources and are used for the COVID-19 prevention and treatment services. So our maternal and child care services are a little bit behind than the COVID-19 period. But our pregnant women, delivery care, postnatal care are also providing the services. Our hospitals, our health centers, that is our routine services, but a little decrease. Now we have a lot of obstacles. Thanks.
Okay. Okay, thank you, Ms. Tidawin, for the explanation to the question. So we go to the next question, also coming from Indonesia, from Ms. Dia. This question goes to Timor-Leste. The question is, what is specific intervention to protect mother and child so that there are no confirmed COVID-19 on maternal and child health? So I give the floor to Ms. Madalena. Please, ma'am.
Thank you, Ms. Mother Dia. So far, we have developed and approved a clinical protocol for ANC, and intrapartum and immediate postpartum, which has been disseminated to all health facilities and trained of health workers, including screening and isolation of pregnant mother and children with suspect COVID-19. Thank you.
Okay, thank you, Ms. Madalena, for the clarification. So we goes to the next question. If there is any more question coming from the participants. Okay, I see none. If I may check to the committee. All right. So we don't have any more questions. So I think this is the end of this session. I would like to thank you, Dr. Sitiporn, Ms. Madalena, and Ms. Tidawin for the excellent presentation and responding to the question from the participants. I'm Dr. Sri Wahyuni from Bureau of International Cooperation, Ministry of Health of Indonesia. Would like to congratulate all the speakers and to all the participants. Hope we can meet again in the future. Thank you. Have a good day. Stay safe and keep healthy. Bye-bye. I give the floor to Master of Ceremony.
Okay, thank you, Dr. Sri Wahyuni, for organizing our first session very well. And before we go to the next session, I would like to remind you that your e-certificate will be proceed after you finish to fill out the evaluation form. So make sure that you give your feedback before the end of this program. And since we have a limited time to do so many things, without further ado, Okay. So after this, we will have a country experience from Vietnam and also Cambodia. And this will be moderated by Mr. Rizkiana Sukandi Putra. So Mr. Rizky, are you already joined us? Yes, okay. So to Mr. Moderator, the floor is yours.
Thank you. Thank you very much. Good afternoon and greetings to everyone. Thank you for all participants who have joined this meeting to share knowledge on MCH handbooks. For this afternoon's sessions, we will share and discuss the implementation and experiences of maternal and child program from two countries, Tusa from Vietnam and Cambodia. I will first introduce the two speakers for these sessions. First speaker is from Vietnam, Mr. Tran Dong Co. He works at Departments of Maternal and Child, Ministry of Health, Vietnam. And the second speaker is from Cambodia, Mrs. Hang Ngim. She works at Training Unit of an MCH, Ministry of Health, Cambodia, as a training coordinator. I do hope these sessions will be fruitful and give us new insights on MCH handbook implementations from our beloved neighbor countries. Without further ado, let's start with the first speakers, Mr. Tran Dang Khoa from Vietnam. For about 15 minutes, is going to share MCH program for all of us in this meeting. To Mr. Tran Dong Khoa, the time is yours, please.
Okay, thank you. Good afternoon, everybody.
Good afternoon.
Good afternoon. So next slide, my country file. Next slide. You know, the country is South Asia. We have a long bordering with China, Laos, Thailand, and Cambodia. Population about 90 million. We have about 63 provinces. Next slide. Referring maternal and child health status, GDP about more than 2,000 US$. High expectancy expenditure for health is 9%. Life expectancy 740.9. Women is productive about 28. MMI 46 per 100,000 live births. Next slide. Referring IMI and under 5 MI in Vietnam, the now is 21 and 14. Next slide. Here is some MCH health handbook in Vietnam. Next. Current implementation stated on MCH handbook from Binh Chair and Hà Giang from 1998 and 2008 we implementation in Hà Giang and continue for province from 2011 and 2014 for province Thanh Hóa, Điện Biên, An Giang and Hòa Bình. And from 2015 and 2059, we have implementation of 53 province. And now 2012, 2020, the Ministry of Health have a decision issue on introduction of format MCH handbook using nationwide. Next slide. This is a picture of a decision from Ministry of Health. Next slide. The MCH handbook in nationwide in health sector from 4 level, in the central level, in province level, in district level, and community level, all of health facility to join in implementation health MCH health handbook. Next slide. Responsibility of Ministry of Health. So first, implementation decision, replacing all the other tools, MCH, monitoring nationwide, such as the medical book, pregnancy check-up, immunization card. The second, support in conducting training, implementation guidelines, and enhance communication, mobilization, monitoring activity. Third, develop electric version parallel with the paper-based MCH Handbook, integrate with primary health, smart card, continue mobile resort, and particular socialization. Next slide. We have a document site to send 63 province to guideline implementation content about essential content format on healthcare during pregnancy, during delivery, Portland and children under 6 with immunization record and growth monitoring chart that may be monitoring by health facility and non-compulsory part. This part will be decided by local by province. Agency where to add a part of medical check-up record and formation on health education based on the list reality. Next slide. Who province including health facility, clinics, hospital, non-public health facility, clinical. Replace medical book, pregnancy check-up record, immunization card of pregnancy women and children under 6. Next slide. Some detailed responsibility and tech example, direct health sector and other connect agency sector allocate local budget from DOC, direct the implementation MCH Handbook in enter province. So difficult in process implementation. CDC be a local point in charge of developing implementation and then carry out organizing training, similar communication active and monitoring. Health facility record full of information regard and data check up delivery, health condition and mother and newborn baby, treatment result or change. CSC make a list of pregnancy women and children under 6 report to district health center, GC and DOC for prepare planning, printing and distribution. Distribution MCH, the health book for CSC combined with the solution guideline to use. Guideline below health worker to implement MCH health handbook. Okay, next slide. Refer consumer maternal children system in the COVID. We have about total 1,283 active 121, recoveries 1,127, deaths 65. Pregnancy women, we have a 6K and a recovery 6. Newborn baby with mother infected by COVID, we have 4 cases. Let's health service system for CC maternal and children health service. The Ministry of Health issued decision to provide temporary guidelines and prevention and management of COVID in pregnancy women and infant in the situation of epidemic. All the infant with mother infected by COVID or pregnancy woman who is suspected of being infected with COVID are entitled to strict measures to prevent epidemic, such as isolation, monitoring, and treatment. Next, please. And all health facilities in Vietnam across the country provide treatment and service to patient condition in COVID epidemic with well pollution and well prevention to themselves and other people. Pregnancy women are still recommended to have a full part-time pregnancy checkup in condition of pandemic, but recommend to book appointment in advance by phone. We must keep a distance of 2 meters and wash hand. Pediatric checkup in treatment service available, but in choose to book advance by phone. We must keep a distance 2 meters. Washing hand with.
Sorry, sir, for 5 minutes more.
Okay, I know. Next slide. All health facility across. Next slide. Current variation during the isolation period under situation of pandemic, immunization service must be closed temporarily. In that situation, children couldn't get vaccine or schedule. Social isolation caused interrupting in pregnancy checkup of pregnant women. Next. In the situation of COVID pandemic, MCH Handbook play good role in self monitoring at home by mother and family member. By taking up MCH Handbook, mother and family member could early detect dangerous signs on both mother and children health and contact to health worker. By recording in MCH Handbook, mother and family member could recognize situation pregnancy and children health immunization. Instead of getting direct consultation by health worker with MCH Handbook, mother and family member could get information and introduction of pregnancy, children health care, and other necessary information from home and epidemic isolation time. Next, please. Also understanding good role of MCH to mother and child health is general mother and healthcare in area COVID. Resort need to printing MCH Handbook is quite big. The number of women who have MCH Handbook now still so small in compare with the demand around the country. We are trying to develop electronic version beside paper MCH Handbook to optimize user MCH Handbook. The electronic version is also developed to link with other health service in the health facility and support. Next slide. Some picture activity implementation health handbook in Cambodia level. Next. This last picture. Thank you very much.
Okay. Thank you, Mr. for your nice presentations. And I remember in Vietnam food, Mr. Tran Dong Qua, your food, chow lau, pao, and Vietnamese spring rolls is very delicious. I miss it. Okay. Let's the next question. The next presentations will be from Cambodia, Ms. Heng Nims, training coordinators, unit of an MCH MOH Cambodia. The time is yours.
Okay, thank you so much. First of all, I would like to respect all of you, all participants and ladies and gentlemen. This time I'm Heng Ngim from Cambodia. I would like to present about the country presentation. Yeah, please. Next slide, please. Okay, this title of the slide that I will present about maternal and child health handbook. But in Cambodia, we have only maternal and child health education handbook. Next, please. Okay, for this, I would like to present about the country profile that Cambodia is located in South Asia. We have border near Vietnam, Thailand, and Laos. For the total population is more than 15 million by Cambodia census 2019. And about the total population under 1 year is 346,000, HIS 2018, and total population under 5 years is more than 1 million, HIS 2018. About the GDP per capita is more than 1,000 USD. Yeah, about the DHF from 2014, we got literacy women was 76, and total fertility rate was 2.7. For the contraceptive prevalence was 56%. Birth attended by skilled personnel more than 80%, and delivery at health facility was 83%. And for PNC, first PNC is more than 90%. For the maternal mortality rate in Cambodia by DHF 2014 is 170 under 100,000, and about the neonatal mortality rate is 18 per 1,000 live birth, and infant mortality was 28 under 1,000. Yes, this is data based from DHS 2014. Okay, next please. Okay, now I would like to present about current implementation data on MCH educational handbook. Yeah, now in Cambodia we have two part of the MCH handbook. This part we call record part that we currently we use whole our country. And for this part, we call information part, but we in the pilot, all in book we give the mother for all information during pregnancy, delivery, and after delivery, and also for the COC too. Okay, next please. We also have a progress for activity in the pilot. The target that we select for the pilot, we select only one province for 2 ODs, and the purpose to assess the effectiveness of the MCH educational handbook and COC card, which is set with national tool in promoting better MCH service. We have an activity like since August 27 to December 2018. Yeah, we preparation of the MCH educational booklet and also printing out. Since February to July 2019, we have activities such as a pre-test for the mother and health workers. And also we organize the training of the trainer for health worker. And also we done for the portrait for the mother. And since 2019, October, we revise MCH educational handbook as like the second edition. And also during this year, in May, yeah, that COVID-19 pandemic, we also we also did the protest to the mother, but we did by the phone call. Yeah, and for this month in year, yeah, we have a protest for health worker, but now it's going not complete yet. Okay, next please. For our pilot with MCH Handbook in Cambodia, we have achievement or and challenge. So overall, the mother knowledge than just sign of a newborn is still limited. However, there are some improvement in some denture sign related to the color. So color of the IEC material are effective. Yeah, in the practice for more mother in intervention area, take their baby to health center than mother in control area if they find danger sign of a baby. Yeah, for COC, ANC visit and delivery at facility have achieved. And for PNC visit need to be strengthened because now in our country we develop PNC more time than before. Yeah. And also we need to strengthen her worker capacity of the MCA education skill with continue training such as cell e-learning, refresher or workshop, and also strengthen monitoring and supervision system too. For the challenge too, we face to stock management need to be improved because some play or some OD could not manage the material when the staff or provider could not report to the OD or to the PhD like this, and when the supporter like the NGO finish, we cannot control or we cannot manage this. So we must be to improve for the stock management. Next, please. Yeah, about part B, we will talk about the country maternal child health system in the area of COVID-19 pandemic. Unfortunately, in Cambodia, we have a good chance that we have only 3 cases finding, yeah, and 0 death. So during COVID-19 pandemic, Cambodia have only the case like export, like export. So during April, July, and October, we got from the WHO database since November 10 for this year. Okay, next please. Yeah, for this slide, I would like to show you about the number of delivery or the ANC at my center that we call an MCH. For the number of delivery or ANC, we not different or quite different, yeah, because as you know the number, yeah, it's the same, yeah, not quite different. Yeah, this is the client or the provider is still work, and the client is still come to provide to get the health service so yeah, during COVID-19 pandemic. Okay, next please. Yes, for health service system for COC in maternal and child health service in Cambodia, yeah, we also follow the national COVID-19 technical brief for maternal and child health service that we just launched for last week. And we also follow the 1,000 days service package. And we also have a safe motherhood protocol for referral and health center. And also we have a guideline of the outreach for health service from a health center. So all the midwife or service provider must follow these guidelines and this protocol to take care or to continue our care of the MCH services. Okay, next please. Yeah, about the.
Sorry for five more minutes.
Yes, thank you. About the community participant in MCH, the community participant is a key role player like health center worker or MCH in chief or health center, village and community, village health support group is tools conduct. So it's when the MCH handbook provider at the rural area or in community, the community feeling or strongly have the MCH health service. Okay, next please. Yeah, about the current barrier or challenge to provide service for MCH service under the COVID-19 pandemic situation. So for this challenge or for this solution situation, all the mother are coming to health facility as usual, but health workers are afraid to providing health services. But we can limit it face-to-face training for health worker, and also we restriction our accompany family member are challenging in a condition to really on task sharing with them, for example, care for mother and baby after delivery. And also some health facility decrease number of ANC and delivery because of health facility got or accept the COVID-19 case for treated. Okay, next please. Okay, about what do we need to address challenge develop solution? We must be we will to provide training related to COVID-19 for infection control, but also to reduce necessary fear for health worker. And now for midwife or whole the country, we continue to training through Zoom webinar too. Yeah, we conduct a CMA, like CMA, Cambodian Midwife Association. Yeah, we only provide training every week. And we plan to develop e-learning training module related to MCH for health worker for their continued education. And for education is very important, not only for the mother, but also for family member regarding infection control during COVID-19 pandemic. Okay, next please. Okay, for the company overcome the barrier or challenges during COVID-19 by using MCH educational handbook. MCH educational handbook in Cambodia is the pilot activity. Yeah. So we must be improved, we must be developed or supervision. Yeah. And the content of the MCH educational handbook are considered to be used for e-learning like the MCH health education module for health worker. Yeah, we will input to the e-learning for train to the midwife that provide the MCH health services. Okay, next please. Yeah, that's all for my presentation. Thank you for your kind attention.
Thank you. Thank you, Ms. Heng Nim, for delivering such interesting presentations. Thank you for all presenters for delivering such, for a very good, very qualified presentations. Next, I would like to give the opportunity for other delegates to give some clarifications or questions to the presenter, or we can exchange some opinions or experience. Please feel free to deliver your opinions. Any questions? No, okay. This is a question from Afghanistan, Abdul Basir. Question for Vietnam. There are 63 provinces in Vietnam. and MCH is implemented in 53. Do you have plans to implement in the remaining 10 provinces? For Vietnam, would you please?
Yeah. Okay. Thank you for the question. Do you know the first? We have a 10 province difficult to implementation MCH handbook because we are very difficult to allocate to budget for printing MCH health handbook and training and guideline and monitoring. So now in 2020, we have already implementation for 10 province now. Now we have a implementation MCH health handbook in nationwide. Okay, complete. Thank you.
Thank you very much. The next questions? Any other question, please?
Vietnam.
Okay, question from to Vietnam again. Please tell me which PCR method for detecting COVID-19 from the oropharynx or nasopharynx more applicable in your country. Which one is better for your country? Please.
Okay, thank you. Question. As you know, Vietnam have one nation unit to about COVID. Now, some information from the nation unit. When you information to you, we must to ask nation unit. Some information I inform you that all of detect COVID to test PCR. Yes, okay. Some the method, details the method. We ask about nation unit. We have answer by email. Thank you.
Okay, thank you. There are two questions from the chat. From Dr. Retno from Indonesia.
Vietnam.
Can I read from Indonesia first? Bu Retno. To Cambodia, the number of deliveries in September was greater than that to the NC. Are there any efforts to prevent the transmissions of COVID-19 from mothers to health workers and vice versa? And what are the efforts to keep mothers monitored? And the other ones from the Dr. Sekar Haddad from Afghanistan to Cambodia also. What is the role of professional associations in the implementations of MCH handbook in your country? Please, from the Cambodia, would you please answer the questions, please?
Okay,
Dr.
thank you. Yes.
Dr. Heng?
Yeah. Did you hear me?
Yes, of course.
Okay, thank you. For the
No.
Yeah, for the thank you for your question. Like he want to ask about the number of delivery in September was greater than that of the ANC. Yeah. So for this question, let me check again because we only took from my hospital September. Oh, you mean September? Since
antenatal care.
No, this year.
September was greater than that on of the antenatal care. So the number of deliveries.
I mean, we get the data only this year on August. September. Okay. Because in my hospital, the the woman go from other hospital or other health center that nearby my hospital. So delivery is more than is greater than ANC. Like this. Yeah, because some around my hospital, they are accept the COVID-19 cases. Yeah, so they are afraid that health facility and they come to my hospital like this. That is greater than NC.
Are there any efforts to
did
prevent?
You get? Pardon?
Yes. I get
Okay.
it. I mean, are there any efforts to prevent the transmissions of COVID-19 from mothers to health workers?
Yeah, we still prevent the mother, and we follow the guideline of the COVID protocol or COVID like this to prevent mother prevent and also the health worker too. Okay, did you get it?
Okay, thank you very much.
Thank you.
Yeah. Another question from the Dr. Shakar Haddad. He said that what's the role of professional associations in the implementation of MCH Handbook in Cambodia?
Association, I mean the midwife association.
Yeah,
like this.
Yeah, association.
Yeah, the role of association.
Yeah,
now we profession.
Yeah.
Okay. What is the role of professional association in the implement of MCH Handbook in your country? Yeah, for my country, MCH Handbook is not worldwide in the whole country. We only pilot for last year and this year. So we pilot only one province and with the 2 ODs. Did you get it? Yeah. So we train the midwife or professional association to guide the woman or to use the MCH Handbook and to provide the MCH Handbook to the woman, and also follow up or supervision to the woman, and some health provider like midwife can follow up or can go to the community like this. Yeah, because we not worldwide, but we have a record part. We can follow up all the women, like even the woman come or woman go to the home, we can educate. Please take care of the record part or mother health record like this. Yeah, so when the woman have a pregnancy and have a labor, we must be advise her to bring the MCH Handbook with them, and we also ask the mother when during the labor too. Then this is the role of professional midwife with the MCH Handbook.
Okay.
Yeah.
That's all. Thank you very much. There is one more questions for you from Isak Langat. He is from Kenya. Isak Langat. Yeah. The question is how can you relate literacy levels in India to information operations?
Thank you so much for the literacy level. We have Ministry of Planning. Yeah, Ministry of Planning respond for the they have survey every year. Yeah, for the responsible for the planning, Ministry of Planning. Yeah, so I could not answer for the because not a role in Ministry of Health, but Ministry of Health involved for the involved with the Ministry of Planning too. they go and they make the questionnaire to ask the people in whole country like this. Yeah, and they, as I know, maybe they make a question or questionnaire to ask about the educational with the people. And we
Okay.
try to,
Yeah.
we try to include more partner in include picture. Okay, and we can input the picture when the woman cannot read, cannot read. We put the picture to show you and to explain the meaning of the picture.
Okay. Thank you very much for your explanations. There are the last question. We still have 5 minutes, so I will give those questions to all of you, to Dr. Tran Dang Kwa and also for the Hang Nim. The first questions from Halima Rahimova. Do you have a national standard for the management of pregnant women with COVID-19? And also the second question from Aditya, Indonesia. I think this is also for the Vietnam, I think. How do you protect village health workers during pandemic regarding their responsibility as the key player? Would you please, Dr. Tran Dang Kwa and then Ms. Heng Nim, to give the explanations and share your experiences in handbook, MCH handbook. Please, yeah.
Okay.
Mr. Tran first, okay. Tran Dong Kwa first, then Mrs. Heng Nim. Dr. Tran, would you please?
Okay, thank you. Question. The management COVID pregnancy, the Ministry of Health have decision number 1271 provide temporary guideline on the prevention and management COVID and pregnancy human and infant in the situation of epidemic. Following the decision, all hospitals to examination pregnancy must be following the decision from Ministry of Health. Thank you.
Okay, thank you. How about Heng?
Okay. Thank you for your question. The question is, do you have national standard or management of the pregnant woman with the COVID-19? Yeah, we have, because on 10 November, on 10 this month, we just update or we develop with another partner like UNFPA, WHO, JICA, many NGO to develop the guideline of the COVID-19 for pregnant women delivery at PNC. Yeah, we have. And also the second question, how you protect village health worker during pandemic regarding their responsibility in the key player. Yeah. For the village too, some we can like limited the people, yeah, cannot go to other during the second or the first wave, and all the village, and we give the IEC to prevent and the health worker or the staff at the health center or some manager at the Ministry of Health, yeah, go to the village and invite some village community to training about how to prevent or protect the COVID-19 at their community or at their place like this. Yeah, we have that. And they willing to have strongly have and have some organized or some non-NGO, non-government to train the health worker like VHG, yeah, to train about how to protect the COVID-19 during pandemic. Yeah.
Thank you, Ms.
Okay.
Henny.
Yeah.
Ladies and gentlemen, the session is now completed. We know that there are various disruptions of MCH handbook usage during COVID-19 pandemic. We already know Vietnam and Cambodia experiences how to overcome the challenges we have nowadays. To all delegates, I would like to say thank you very much for your inputs and comments, and I will give back the floor to the host. Thank you very much. See you soon.
Okay, you're welcome.
Yeah, thank you Bapak Rizky for your time to conduct the sharing experiences from our colleagues in Vietnam and Cambodia. So jump up to the next agenda. We have summary of the day, and it will be presented by Mr. Aryo Baskoro. To Mr. Aryo, the time is yours.
Good afternoon, delegates. Distinguished delegates, ladies and gentlemen. First of all, we would like to thank you and appreciate for all committee and all participants and all presenters that today's meetings goes smoothly and on time. Alhamdulillah, we have come to the end of second days. During these days, all the participants has joining the virtual meeting, and the program has been viewed by 95 observers. Today, we have already learned a lot of experience from Thailand, Timor-Leste, Myanmar, Vietnam, and Cambodia in overcoming the impact of COVID-19 pandemic to the maternal and child health and the implementation of MCH handbook. From the presentation, there are several things that we can highlight it. In the term of MCH services, during the COVID-19 pandemic, we learned that COVID-19 pandemic has significant impact on MCH services, especially in access to the services has been hampered due to the increasing confirmed cases, lockdown policy, fear of infection, stigma, and overwhelmed health system. We can see in Thailand, mothers are skeptical of breastfeeding and absence of parental school session, difficulty for public transportation. In Timor-Leste, we can see this disruption in supply chains, lack of space and lack of adequate equipment in pandemic situation. We also can see in Myanmar overburden of midwives and travel restriction. In Vietnam, immunization services are closed for temporary. In Cambodia, health workers are afraid to provide services and need to train by online e-learning. Some countries are facing a problems of the availability of the adequate PPE, isolation room, and adherence to the infection prevention protocols in community and health facility. To overcome the situation, policy and guidelines are important, have to be updated in each country to adopt MCH services to pandemic condition. Optimizing the use of information technology could be solution to maintain the communication between family and health workers. For MCH handbook implementation, we have discussed that in Thailand, we'll use social media to promote health literacy, strengthening village health volunteer, and resilience the health services delivery system. In Timor-Leste, need support for financial to MCH handbook provision and technical support for orientation new MCH handbook. In Myanmar, development of MCH handbook online application need to be supported. Adapted information with pandemic situation and for the efficiency of monitoring maternal and child healthcare delivery system. In Vietnam, During the pandemic, MCH Handbook could play an important role as an information source for family and community to raise awareness of maternal and child health and a tool for home-based health monitoring for family. But the utilization of MCH Handbook is still low compared to demands. In Cambodia, we can see MCH Handbook is still pilot activity and content MCH Handbook considered to be used e-learning. Continuously improvement for implementation MCH Handbook is still needed, as well as monitoring evaluation for MCH Handbook should be conducted to understand more about the effective utilization and implementation. That's all for today. Thank you for your attention and for your participation. We hope this knowledge sharing session can bring us for better future for our mother, our child, and our country. Stay safe and healthy. Thank you.
Thank you, Mr. Aryo, for reflection, the best practices from 5 countries shared today. And then next we have Miss Keiko Osaki join us directly from JICA headquarters, Japan, and to facilitate your action plan. To Miss Osaki, the time is yours.
Thank you, moderator. Good afternoon, ladies and gentlemen. My name is Keiko Osaki, Senior Advisor on Health of the Japan International Cooperation Agency, Tokyo. I'm great honor to be a facilitator of your action plan for 2 days very fruitful discussions and presentations. As we already know that WHO recommendation on home-based records for maternal, newborn, and child health was a benchmark for us to work on home-based record, including MCH Handbook. So it tells us the basis for the evidences for the outcomes for the communication and the health service uptakes. But at the same time, the guidelines tells us the more efforts need to be done for the effective implementation. Today and yesterday, we had many the presentator, and which are staying at the different level of the maturity of implementation of the MCH handbooks. Some countries stay at the pilot level, and some countries stay at the scaling up level, and some are trying to build MCH handbook into the health system. Definitely, if you're staying at the different maturity level, so the different activities we need to identify. Another guideline under the context of the COVID-19, you may already have acknowledged this guideline to ensure the essential services for MCH to be continued in the context of COVID-19. And to realize that, I believe your country already have developed the protocols to address it. But one more guideline will be your friend, because the immunization, the programs already issued a guidance for the planning and implementing catch-up vaccination. In that guidance, they definitely they clearly mentioned that importance of the home-based record, including MCH handbook, for the routine immunization programs, as well as for during these COVID-19 times, is to be strategically used. If we look at the areas we need to work under this context, so of course, the many areas we need to do it. We need to have some infection protection for the health personnel at the service points and the researchers, knowledge sharings. All we cannot address with MCH handbook, of course not. But some stats indicated us that some countries has used MCH handbook linked with these action areas. For example, the green one is if you have the national protocol, that some country adopt MCH handbook into it clearly and to define the significant role of MCH handbook in addressing the COVID-19 the essential service provision of MCH. And then the 4 countries are mentioning they're using MCH handbook as the monitoring tool to ensure, to check whether that this individual has already received the services like immunization. The 4 countries says we are using this one for the sensitizing women and to access services and also promote more active self-monitoring like child development monitoring at home. And the 3 countries says we are using it for the promoting infection prevention at home and also the home care like breastfeeding. And some others says it's a basis for the standardized education material. That's why we can expand and use it in another way on the web platforms or the linked to the further e-learning sessions. So if we learn from country presentations of yesterday and today, the strategic use of MCH handbook for the context of COVID-19 is observed among countries attending this KSP 2020. Overall, health services were modified for the context of COVID-19. With community health workers' help, or sometimes with the technology help, essential services were to be maintained while overcrowded situation in health facilities were prevented. And the strategic use of MCH handbook was emphasized, as I mentioned, and the scheduled MCH handbook activities were providing opportunities for strengthening capacities of health workers by adding contents for addresses for COVID-19. And some countries already recognized the contents is standardized education material. That's why they expanded to other materials or linked to other sources. Connection between health workers and the mothers was sought, while strategic use of MCH handbook. So the paper MCH handbook is not standalone, so they are linked up health workers' efforts and the community health workers' support and networkings by the SNS among clients. So thank you for your great work, hard work to develop the action plan. I try to categorize into 3 the areas you developed actions. So if I try to summarize and then try to give some feedback, but if countries found my understanding is not correct enough, or that you would like to add more detailed information for our learnings, please do so through the chat box. Okay, maybe the first area is the actions to proceed maturity of MCH handbooks use in your health system. Okay, the second is actions to use MCH handbook strategically for ensuring essential services during COVID-19. Third area is actions to strengthen networks within and between countries. Afghanistan, as the blue faces tells us that their focus is for the increasing the maturity of implementation of the country's MCH handbook. So the 34 provinces and the 23 provinces they mentioned, so means the step by step, they are now in the process to increase the coverage of the implementation of MCH handbook. The pale color of the face tells us that it's after the scaling up, they are going to build in the implementation of MCH handbook into the routine health service provision systems by integrating MCH handbook in contract of implementing NGOs. To my knowledge, in Afghanistan health system service provision system, the NGO contracting out is a very much essential part and the strategy to provide the essential services till the end of the country. That's why to integration of the MCH handbook into the contracts to the NGO is very much strategic and the reasonable way to make it routinely conducted. Okay, so my question is, so how after having the integration of the implementations, the Afghanistan does have any plan to monitor MCH handbook implementation in national health systems, maybe by the Afghanistan DHS or not? And do you have any plans and the planned activity from MCH handbook as an opportunity to use for the addressing challenges with COVID-19? So if you have the training sessions, maybe you can marriage with the COVID-19 the contents for the health workers, the capacity strengthening. Next is Cambodia. As the lady presented, we understand your MCH education handbook is still the pilot phases, and it's a complement for the ongoing home-based record, like child cards and as well as the maternal cards. So the blue color tells us that you are doing some training and the distribution and the supervision in the pilot area. And the pale color tells us that the contents will be already understood, recognized as the standardized national education material. That's why you would like to use it for the more generic way, the using for the e-learning for the MCH health education competency for health workers, as well as you are planning to develop some supplemental activities like group sessions for the health education in that sciences guess. Okay, so how can you use these planned activities already to address for the challenges with COVID-19? So maybe you can have identified some potential to address for COVID-19. Kenya. The four simple the actions they listed up. I do not have enough detailed the information about the digitalization of MCH handbook, but it may be the plan to link with the DHS tool, which is the facility-based data, and then draw out the data for the MCH handbook digitalized one, or you would like to up some education materials on the website or something. But anyway, so those are the new the actions you are planning, I guess, and the printing distribution may be addressed to the needs of the MCH handbook under the COVID-19. So those areas could be discussed, and the more the plan, the more details. We welcome your the detailed informations. So, and the pale color maybe it's the supporting still you feel some the weakness in the implementation of the MCH handbook even before the COVID comes. So capacity building for the effective utilization, I believe your country have a good practices. The missed opportunity vaccination analysis, that from the EPI perspectives, you already identify some capacity that is lacking. That for that, the beyond immunization, MCH handbook could be used and recorded. And a periodical assessment on implementation, it could be done by Kenya. So because your data is linked to Kenyan HIS systems already. So if so, maybe you have some plan to have MCH handbook implementation to be monitored through KHIS or maybe the KDHS as well. Why I'm saying about the DHS? There's some country, many country has mixed or DHS, and through that data, we can identify where is the gaps between the ownership among some the clients. For example, that they ever have MCH at home-based records and currently have. This gap tells us the loss rate. in male and female gender gaps, or urban or rural, the residency gaps, or the economic quintiles gaps. So this kind of the data is already available on the website of WHO, but unfortunately, this data is only for immunization, but not for antenatal care or growth monitoring, because the DHS questionnaire does not adopt the other questions. So maybe the some country already did it, so the Kenya could be a part of that kind of the country. Okay, next, Laos. So thank you for indicating clearly your intention to use the MCH Handbook as a tool for strengthening the quality and the safety essential services during COVID-19 pandemic for health center staff. I guess you'll have a chances to have to disseminate the new updated MCH Handbook. So through the process, you may have some chances to strengthen the health workers' capacity to address COVID-19. But at the time, maybe we can know the SOP in your SOP is of the ANC or some other clinical cares are already clearly indicated how to use MCH Handbook effectively to ensure to monitor the prehistory of the service deliveries, and for the next coming it can be reminded well so that they cannot drop out from the essential services flow. And I thank you for your eagerness to engage private hospitals in use of MCH handbooks. I remember that you are already interested in and then try to work hard for engaging the private sectors since last year. So I welcome your eagerness and I would like to see your achievement in next year. So other points are only is the flowing the activities after this, I guess. Myanmar, welcome. So that you are now at the finalizing stage of the renewed MCH handbook. And then as you already told in your country presentation, the MCH handbook in your country is already a part of the health systems. But again, you are very much serious to use it more effectively to increase the outcome of the service coverage and also the quality services, I guess. That's why you are now planning to have the pilot in the selected townships and try to check its feasibility and print it and distribute it for the nationwide. And then try to have the assessment, its effectiveness in the feasibility and also feasibility of the utilization as well as effectiveness on your expected outcomes. So do you have any good designs or the monitor effective use by health workers in providing quality continuum care? This is just for your information, but this is available on the technical brief of the JICA website, and also the paper is already published in the scientific the journal. How to know continuity of quality care through MCH handbook. Based on the former the version of the Myanmar MCH handbook, a researcher did research to measure how much the individuals have already access to the care, its frequency, at the same time, the contents of the services they received. Across the timeline, antenatal care, postpartum care, and the postnatal care, so the coverage context are enough, but not all. I'm sorry, it's a little bit limited. And the quality care means the contents, how many services they received as they designed. And so it's not necessarily the same as the context frequency, but coverage of the service kinds. So it means that access to care is improving, but how about the quality? It's still questioning. but it's based on the record of the home-based record, MCH Handbook. They can measure this kind of, they can touch the quality care, not only just the counting the contacts. So it tells us how to design as a whole, the increasing the quality of care with the help of the records in MCH Handbook. Tajikistan, welcome. So now you see the pale color of the face on this. It means you are now trying to address the issues to make your handbook to be in the health system. So now you are, if I remember wrong, you are now doing the pilots in the 38 regions. And I think you are now you are trying to revise the MCH handbook based on the result of the pilots. See? And then revised MCH handbook will respond to the whole other countries, remaining countries' needs. So that's why you would like to get the approval from the ministry, the authorities, and also you would like to put into the national training systems so that all the health personnel are getting the benefit and to be the user, the active user of MCH handbook. But at the time, and also do you have evaluation plan? You also have the passion to influence the many stakeholders who are influential in the community, and to the women, and to the school ages. But when you design the MCH handbook or you revise the MCH handbook, the one point I would like to remind you, and I'd like to ask you to keep in mind. If we expect a lot from MCH handbook beyond the data recording, but for the communication media and or the referral functions, those, if we increasing the function we expect, usually the required capacity for the health personnel, required capacity for the mothers increasing. That's why if you found any gaps between the functions you expect and the functions that can be realized within the current users' capacities, you need to take a strategy from two. One, downgrade the expected function, for example, from level 2 to level 1, or add supplementary elements to increase users' capacities. For example, design to be simplified, or add some educational material activities to increase the capacity of mothers or to health personnel. So as you are trying to engage more people so that make more everyone's business, so at the time always many voices come and many contents come, and then it makes the MCH handbook is very much thick. So you are now standing at the very good points at the beginning. So, but please keep it in your mind. Please do not make a dictionary, but a simple one as much as possible. So at the time, you can remind gap analysis and can reduce your the voices to be minimized. Okay, so finally the Indonesia. As a national one action plan we got, adding to the current the JICA MOH project, develop little baby handbook for a child health checkup, and the digital background the research are ongoing, I know. And adding on that, the collaboration with early education sectors are identified to expand or to strengthen more networks to implement MCH handbook utilization in early education institution and at the age of the preschool ages. So for answering to supplement that, the province voices and the district voices are very much enriching their ideas. For example, from province Central Java, so they would like to the approach to the school age, and then they would like to socialize more MCH Handbook for the pandemic responses by using social media. West Sumatra province, they acknowledge the local villages. Nagari is the good gatekeeper of MCH Handbook smooth operation. And Padang Pariaman is the one district. I think they have the ideas to match with the COVID-19 responses with MCH Handbook more effectively. In the West Nusa Tenggara is another province. They would like to use it monitoring and use the MCH Handbook for monitoring and evaluation for child the growth monitoring, especially under the COVID-19, the limited the contacts between the health personnel and the family members. Another one is the survey of MCH Handbook, feeling completeness and the mother's knowledge and the monitoring. That kind of assessment efforts are very much welcome, and it's better it will be linked to the next step for you to increase your service provision with the help of the MCH Handbook. And also it's responded by the district in the same area, the West Lombok, in the same way with the province of West Nusa Tenggara province. And the Sleman is the Java district. And they said, besides, among other list of the activities, they listed up some regulations will strengthen or emphasize and enforce that the more use of the MCH Handbook by many different stakeholders. And a workshop and there's some symposium, seminars, they are planning to start the new service delivery package with ICHC with MCH Handbook. Okay, so the actions to proceed maturity of MCH Handbook use in your health system, you listed up a lot. Thank you very much. And I think those actions were much more progress than last year, I guess. But at the same time, how we can use the planned activities for MCH Handbook to be the opportunities for addressing challenge with COVID-19. We can use it more ambitiously. And the next, and the actions to use MCH Handbook strategically for ensuring essential service during COVID-19. Yes, we can think how we can use MCH Handbook strategically more for this. Actions to strengthen networks between countries. So we can continue learning through KSP and beyond. And maybe we can do some collective actions to make like the DHS mix to accommodate MCH Handbook implementation data on it. Thank you very much for your attention. And as someone, if you would like to have any comments from the countries, I really appreciate it. Maybe you can send me the chat if you'd like to say, or if you'd like to read on behalf of you. Welcome.
Thank you, Keiko-san, for your comprehensive feedback, supporting us to develop and to expanding the MCH Handbook. Regarding the MCH Handbook, increasing quality services of mother-child health and the advantage, the benefit already we already become our benefit to the quality of MCH services in our country. So Keiko-san have giving us feedback to country's plan of action and notify us that our plan of action with coloring blue for maturity in health system, proceed maturity in health system, and then red for ensuring essential services, and green to strengthen network within countries. And I, from Indonesia, thanks for your supporting. I got green one, yeah. I got green one to strengthen network with countries, because we plan to collaborate with education sector to increasing utilization MCH handbook among the early childhood. So we plan to collaborate with organization of teacher of kindergarten and so on. Okay, and my notes, your blue notify, you give for Afghanistan, Cambodia, Myanmar, Tajikistan, and Tajikistan got blue and green. Kenya got red and blue, Laos red and green. I think that's helping us to focus for our activities in the future. Maybe we still have 2 minutes for delegates. If you have any comments of any opinions.
Hello.
Yeah.
Hello, this is Dr. Habib from Afghanistan. Very nice to meet you, Dr. Osaki. Thank you so much for your inputs and our action plans. Of course, we do consider your recommendations. And very nicely you mentioned the issue of monitoring after integrating in the BPHS contracts. Of course, we have planned to create a dashboard in EHIS2, and it will be a monitoring tool. And we are currently in the trial day 20 stage of our dashboard, and soon we will share the link with you as well. And also regarding engagement of private sector, we of course have some intervention in 2021 to have some interventions in the private sector as well. And also regarding assessment, we have planned to assess the MCH handbook during 2021, inshallah. Thank you so much.
You from Afghanistan, yeah? Yeah, thank you. Any delegates? Any other delegates?
Can you give us some comments and some supplemental information?
Tajikistan? Oh, Thailand. Okay. Yeah, please. You have maybe more than 2 minutes. Yeah, please.
Hello?
Yeah, hello. Clear voice.
Yeah.
Tajikistan.
Sahor from Tajikistan. Thank you very much for best comments and observe from Osaki-san. Thank you very much. It's a good point from your side. And of course, since 2016, utilizations and implementations of MCH handbook in our districts, pilot districts, we start with 12 districts. But after 1 year, we implemented in 26 districts. Yes, but we're planning to change and increase a level of MCH handbook in other pilot district also. But 2019 we had privilege to monitoring to spend the monitoring in these pilot districts, but we have good result from this monitoring, but we didn't show this result because from our Ministry of Health doesn't confirm yet. But we waiting for confirmed by our Ministry of Health. Thank you very much.
Yeah, thank you Dr. Sahlo and all delegates. Keiko-sang giving us feedback for countries who sending plan of action to us, and then Thailand just sending and just received by committee. So if you have any question or have any comments, please. Thailand?
Yeah, can help. Okay, so thank you for your hosting this event. It's very interesting and it's very fruitful discussion. Yeah, as I observed that many of the countries we are in the different stages. For Thailand, we are already implement the pink book, that's the nickname, nationwide. But currently, we have found that most of the mothers, they also have the pink book when they come to the facilities. But yes, sometimes when they come to the hospital with like other symptoms, the URI or other diseases, they may forget. So what countries can learn from this is that to ensure and to emphasize that this is like your ID card when you're going to the hospital for the mothers, and it is improving. Another thing is that we need to transform this print book from the hard copy into the mobile application. So it will be seamless connection between like private and public hospital, and it will solve the problems that mothers forget to bring their book with them. But however, because the pink book consists of the education part and also consists of those parts that doctors will write the ultrasound, the result, those kind of things, that is maybe hard for them to type in their phone. So this thing is another step that we need to engage the collaboration between other countries and also some people that may have more technical issues. Yeah, thank you.
Thank you, Thailand. Keiko-sang, have you any feedback for Thailand?
Thank you.
Have you any feedback? Yeah.
Yeah, I really appreciate from the inputs from the Thailand, so that you always have some innovations and then they stimulated us for the further discussions. So in many countries has the thinking about the digital will support or how to get the support. So maybe we can continue discussions. So because it's very much context specific, the context will influence their choices, and not single ways it will fit for everyone. So we need to have we need to keep discussions on this, and I really appreciate your cases.
Thank you, Keiko-san. Maybe Indonesia also facing that constraint to develop into digital kind of MCH handbook. It's related to data security and medical record regulation like that. So I agree we still need further discussion to develop into electronic system. Yeah, and we have 1 minute less. I give a chance to Kenya to convey opinion or some question, if any, from Kenya. Miss Lydia.
Yes, thank you. And I'm glad to see Keiko. How are you, Keiko? And thank you for your continued support to us as a country. We highly appreciate. I just wanted to just share that for Kenya for digitization, we have something that we had started and we were calling it Jamii Smart. It's a mobile application. But we went up to the pre-testing utilization. But we encountered some issues, development issues, and we stopped at some level. So maybe we can be assisted in picking it up and finalizing that digitization process. Thank you.
Yeah, thank you, Miss Lydia. Thank you, Keiko-san. Regarding the time is up. Once again, I thank you for your support and all participants who give the opinion and who sending plan of action. The benefit will come to us, to our country, and we increase the mother and child health in our country and will contribute to the global mother and child health also. Okay, thank you very much for your attention. Maybe I will give back the time to Mr. Gaung. Yeah, yeah. Thank you, Mr. Gaung. Yeah.
Yes, thank you, Dr. Dia, for tackling down the short discussion between the participants and also Ms. Keiko Osaki. So, otsukare sama deshita, Ms. Keiko Osaki, for joining us and give a comprehensive feedback to the participants' action plan. I wish you a good health and stay safe. So, we entering the final session of today's agenda. Moving to the next speaker, we have Ms. Sito Rukmini, who will announce to you the post-KSP report. To Ms. Sito, the time is yours.
Thank you, Mr. Gaung. Distinguished delegates, ladies and gentlemen, good afternoon. I hope you are doing well. First of all, let me introduce myself. My name is Sito Rukmini. I work for Ministry of Health in the Directorate of Family Health. I would like to say thank you for your enthusiastic participation in the Knowledge Sharing Program on Maternal and Child Health Handbook 2020. We truly appreciate your time and effort for sharing the experiences and lessons learned on MCH Handbook implementation in the era of COVID-19 pandemic. We provide certificates for all participants and observers who join in today's event. The certificate will be sent by email to your email address. Therefore, make sure you have write correctly your email address when you fill the attendance list. The certificate will be sent after participants and observers have filled completely the evaluation form from the committee that has explained by Mr. Egi from the Bureau of Foreign Technical Cooperation. And the committee has already shared the link in the chat box. Lastly, thank you for all participants that have already submitted the plan of action. It will be useful as a description of the achievement and progress of the implementation of MCH Handbook. that will be monitored by JICA. Hopefully, your plan of action is also useful for you and it can be implemented in your home country. Coordinate with your colleague to have networking, as of you have more resources to expand or strengthen the implementation of MCH Handbook. Furthermore, hopefully we can contribute to strengthen the maternal and child health services, particularly during in the COVID-19 pandemic. That's all from me. Stay safe and healthy. And I will give back the floor to Mr. Gaum. Thank you.
So thank you, Ms. Sito, for your announcement. And once again, we would like to remind you to fill the evaluation form sent by the committee through the chat box, because your feedback is very important for us to improve for the next program. Distinguished participants, ladies and gentlemen, finally, after 2 days of fruitful knowledge sharing session, we are coming at the end of the program. I really hope that all of us have learned a lot from each other and be able to strengthen cooperation and collaboration among us. To conclude the program, we will have 2 remarks from the government of Indonesia. So now I would like to invite Mr. Ricky Sailendra, the head of Division for South-South and Triangular Cooperation, Ministry of State Secretariat. To Mr. Ricky, please, the time is yours.
Thank you, Pak Gaum. Ladies and gentlemen, a very good afternoon for all of you. I'm Ricky. I will deliver closing remarks from our Ministry of State Secretariat of the Republic of Indonesia to the knowledge sharing program on maternal and child health handbook, or MCH. The themes is sharing the experiences and lesson learned on MCH handbook, implementation in the era of the COVID-19 pandemic. Bismillahirrahmanirrahim. Honorable Dr. Erna Mulati, the Director of Family Health, Ministry of Health, honorable representatives from Ministry of Foreign Affairs, representatives from Japan International Cooperation Agency, or JICA, and also the representative from National Coordinating Teams of South-South Cooperation Indonesia, distinguished resource persons, participants, and the program committee. Assalamualaikum warahmatullahi wabarakatuh. May peace be upon us. Alhamdulillahirabbil alamin. First of all, let me convey my gratitude to Allah Subhanahu wa Ta'ala, the Almighty God, for His blessing and guidance which enable us to conduct this event. On behalf of the Ministry of State Secretariat and National Coordination Team of South-South Cooperation Indonesia, I would like to congratulate all the participants from Afghanistan, Cambodia, Laos PDR, Kenya, Myanmar, Tajikistan, Thailand, Timor-Leste, Vietnam, and also Indonesia for completing this 2 days webinar program. This program was designed by the government of Indonesia together with JICA as one of the Indonesia's SSTC flagship programs. Its aims is to be a platform for the participants in sharing experiences and lessons learned about the implementation of maternal and child health handbook. For the past decades, we have been inviting participants from various countries to come to Indonesia to share their knowledge, know-how, and to observe the implementation of MCH in various regions across Indonesia. However, during this current global COVID-19 pandemic, the government of Indonesia and JICA adjusted the mechanism of program implementation and conducted through virtually. Nevertheless, we hope that all the participants still gain the maximum benefit of the program. As part of the international community, the government of Indonesia is committed to develop and conduct various capacity building programs through South-South and triangular cooperation that not only beneficial to our neighboring countries, but also to improve our ability and knowledge. Furthermore, we expect that this initiative can be the foundation of the future collaboration between Indonesia and the other countries. Ladies and gentlemen, to strengthen our commitment on international development, Indonesia has taken a step ahead by launching the Agency for International Development Fund, or Indonesian Aid, at the end of 2019. Our hope through the Indonesian Aid is that we can increase Indonesia's contribution and maximize the cooperation with various countries around the world through grant schemes, humanitarian assistance, and the capacity building programs to achieve the Sustainable Development Goals. Friends and colleagues, these past 2 days, you have learned about Indonesia's best practices in the implementation of MCH during the coronavirus pandemic, including the policies, initiatives, strategies, monitoring and evaluation mechanism, and also the role of some regional government. During the sharing session, we also gain knowledge from sharing experience sessions on how the other countries dealing with their obstacles and the problems in implementing MCH. So, for example, for all of you, strategy of some countries adopting the Industry 4.0 and utilizing the mobile application in the MCS implementation to reach wider community. I am very pleased that all participants have contributed actively to each session. All these activities are the manifestation of the program themes, which is knowledge sharing program. We also expect that all participants could give us feedback during the monitoring and evaluation session. Your feedback is essential for us, for Indonesia, to improve Indonesian South-South and triangular cooperation programs. To conclude my remarks, last but not least, I would like to appreciate the Ministry of Health and JICA as our pivotal partners for the efforts and keen supports and the NCT of South-South Cooperation members Indonesia, such as Ministry of Foreign Affairs, Ministry of National Development Planning, and the Ministry of Finance. Also, to all the research persons and my beloved colleagues, the committee, for all of your heart, idea, and support to manage and facilitate this program. Once again, congratulations to all the participants for completing the knowledge sharing program on maternal and child health handbook. We wish you the best of luck in all of your future endeavors, and hopefully we can meet again in another face-to-face training program soon. Thank you. Stay safe, healthy, strong, and happy. Wassalamualaikum warahmatullahi wabarakatuh. God bless you all. Thank you. Balsoyu spesiba. Kapunkap. Wassalamualaikum warahmatullahi wabarakatuh. Alhamdulillah. Hirabbil alamin. Thank you.
Thank you, Mr. Ricky, for your remarks. And I would like to invite Mrs. Erna Mulati, the Director of Family Health, Ministry of Health of the Republic of Indonesia, to deliver her closing remark and officially close the program. Please, to Ibu Erna, the time is yours.
Representative of the Ministry of State Secretary, Representative of the Ministry of Foreign Affairs, Senior Representative JICA Indonesia, distinguished delegate from Afghanistan, Cambodia, Kenya, Laos PDR, Myanmar, Tajikistan, Thailand, Timor-Leste, Vietnam, and Indonesia. Observed from JICA headquarter countries, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. I would like to begin by thanking you for your participation during the 2 days of knowledge sharing program, sharing the experience and lesson learned on MCH Handbook implementation in the era of COVID-19 pandemic. I believe that during these 2 days, all of us has obtained a fruitful discussion. We have learned a lot from each other's experience in handling the COVID-19 pandemic impact on MCH and the implementation of MCH Handbook during the COVID-19 pandemic. Once again, on behalf of the committee, thank you for delivering such important materials so that all of us can deepen our knowledge. I observed all presentation and discussion, so I can conclude that the purpose of the program have been achieved. By the end of the program, we must to commit the work ahead of us. We still have to continue our work to continuously improve the maternal and child health status. In the other hand, the end of the COVID-19 pandemic is still cannot be predicted. Thus, we have to double our effort to keep up with the target that have been set. I hope that this unfortunate situation would not be an obstacle to development and the implementation of MCH Handbook. Moreover, the MCH Handbook could be an opportunity to reach out mothers and children with the essential health care. I hope we can resolve to translate the inspiration from each other into policies, program, and action that deliver results. I believe through our health effort to our home countries will contribute to the increasing of maternal and child health status globally. At once, we maintain international cooperation. Finally, on behalf of the Ministry of Health of Indonesia, I would like to express my appreciation for the collaboration of the Ministry of State Secretariat, the Ministry of Foreign Affairs, and JICA for the hard work in organizing this program, and also my gratitude the delegates of Afghanistan, Cambodia, Kenya, Laos, PDR, Myanmar, Tajikistan, Thailand, Timor-Leste, Vietnam, and officers from all around the world for taking time out of your busy schedule to attend this program. Together, we will monitor this activity until we meet again next year. I would like to close my remarks and officially announce the end of the program, expecting the oncoming collaboration between all of us. Thank you very much.
Thank you, Madam Director Erna Mulati, for your closing remarks. And this is the end of the program, and it's selfie time. So I would like to invite again all of the participants to turn on your video, because we will have our last selfie for this program. Okay, we will wait our colleagues to turn on the video. Please, also the committee, maybe you can turn on your video. As you can see here, there's also a committee who organized this training program. Okay, so we good, right? 1, 2, 3. Once again, you can put your hands like this, or maybe like this. or maybe like this, please feel free. 1, 2, 3. Uni. Okay, arigatou gozaimasu. And that concludes our program. And on behalf of the government of Indonesia, I would like to thank JICA for facilitate this program, all of speakers, and once again, the participants for your active participation. We really hope to see you again in the future. So I wish a good day and applause for all of us. I'm Gaung signing out. Wassalamualaikum warahmatullahi wabarakatuh.
Terima kasih banyak. Sampai jumpa.
The first 5 years are children's golden age of growth and development. When they begin to recognize their 5 senses and absorb so many things around them. At this age, parents play very important roles, especially in parenting, providing their children nutrition, and taking care of their children's health. Doctors, nurses, midwives, and health personnel play roles as a family's partner who are always ready to get involved directly in community, even to become reliable key supporters in education units. Conducting direct examination to the children, giving advice to their parents on health issues, providing guidance on hygiene behavior, health, and daily nutrition. Health personnel always stand by at integrated health service station in every city and village to immediately serve the community, whether for checking the ideal infant weight or for examining the infants and under 5 children's level of development. Also to ensure the parents get MCH handbooks as their trusted guidance.
Balita sehat, Indonesia unggul.
Public Health Center as the facilities for providing health service to the community are always ready to monitor children growth and healthy and to ensure they achieve their maximum growth and development, to give MCH handbooks and to keep the children medical records and cohorts in every detail. Mothers use the MCH handbooks twice higher, antenatal care access, childbirth at health facilities, and childbirth service. Mothers use the MCH handbooks 4 times higher, complete basic immunization access, a time weighing access twice a year to conduct detailed and thorough examination on the under 5 children growth and development, to educate the parents in order to get involved supervising their children growth and development. Stimulation, detection, and early intervention on the children growth and development is performed with full of dedication. The health personnel use development pre-screening questionnaire to monitor the children growth and development, and the parents keep the record of their children's development period in the MCH handbooks. The health personnel must also be capable of becoming discussion media in order to make the parents feel comfortable and free to give information or ask questions regarding their children's development and health, and spend their time to attend class for mothers of children under 5 years of age as a means of educating parents as children nurturers. The greater the percentage of public health centers organizing class for mothers of children under 5 years of age, the larger the coverage of a time a year weighing for children under 5 years of age. And in deteriorating health condition, the health personnel are always responsive to handle the problem. The greater percentage of the public health centers performing integrated management of childhood illness, the lower the death rate of neonates, infants, and children under 5 years of age. Because it is in their hands the future of our nation lies. If the children under 5 years of age are healthy, the generation will excel and Indonesia will prosper. Presented by Directorate General of Public Health, Directorate of Family Health.